Hello, anatomy students. I'm going to go over the muscles of the thigh and lower leg. There are, I believe, 21 muscles that will be covered in this segment. As usual, each muscle has two slides where on one slide I show you a good photo demonstration, and then the second slide it tells you the origins, insertions, and actions. And that way you can print these up and create flashcards from them if you want. So this is going to go in order of your hit list. And the first muscle up for thigh muscles will be the sartorius. And the sartorius is shown here at the end of the white pointer. Of course, there is a right and a left, but I'm going to highlight them in green. And the sartorius is oftentimes referred to as the tailor's muscle, because back in the old days, a tailor would take the fabric and drape it over their leg to do their mending, to do their sewing, and they would flex at the hip and abduct their thigh, laterally rotating their thigh, and it also flexes the lower leg. So that's why it was called the tailor's muscle. The sartorius has its origin on the anterior superior iliac spine, and its insertion is on the tibia. Again, its action is to flex, abduct, laterally rotate the thigh, but because it also crosses the knee, it flexes the lower leg. Our next muscle is the gracilis. Its origin is on the pubis, which you could have guessed from that. It's on the inner thigh. I'm highlighting it here. And it inserts on the medial tibia, which you can see down here. That's the medial side. And its action is to adduct the thigh. It's an adductor, meaning put together, go towards the midline of the body. It flexes and medially rotates the lower leg. Our next muscle is part of the quadriceps femoris muscle group. There are four. So we have the rectus femoris, the vastus lateralis, vastus medialis, and vastus intermedius. The rectus femoris is the only one of the four that actually crosses the hip and knee. Therefore, it will have actions at both. The rectus femoris flexes the thigh at the hip, extends the lower leg at the knee. Its origin is the anterior inferior iliac spine, and it inserts on the patella and tibial tuberosity. In fact, all four muscles of the quadriceps femoris muscle group will insert on the patella and tibial tuberosity. So here is the right rectus femoris. And you can see down here that it leads to the quadriceps tendon, which then crosses the knee over the patella and then turns into the tibial ligament and then inserts on the tibial tuberosity. Here is the other rectus femoris. So again, the rectus femoris is part of the quadriceps femoris group. It is the only one that works across the hip as well, and that's because of its origin being on the anterior inferior iliac spine. It's going to flex the thigh and extend the lower leg. Our next muscle of the quadriceps femoris group is the vastus lateralis, shown here and here. The vastus lateralis is going to have its origin on the greater trochanter It's going to insert on the patella and tibial tuberosity, and its action is only extending the lower leg. So it extends at the knee. Next muscle is the vastus medialis, shown here at the end of the white pointer, but I'm also highlighting it in green. The vastus medialis has its origin on the linea aspera. It inserts on the patella and tibial tuberosity, and again, it's going to extend your lower leg. The vastus intermedius is actually deep to the rectus femoris, and that's what you're seeing in this picture. Notice that the rectus femoris has been removed. Let me show you a previous picture. So here's your rectus femoris, and that has been removed from this model, and this muscle that you're seeing underneath of it is the vastus intermedius. It has its origin on the proximal femur, and it inserts again on the patella and tibial tuberosity. Its action is to extend the lower leg. Now we move to the pectineus, and the pectineus is a small muscle on this model, at least what we can see, that isn't covered up. This blue, red, and yellow structure that you're seeing here is the femoral vein, artery, and nerve, and the pectineus is more medial to those structures. The pectineus has its origin on the pubis, and it inserts on the linea aspera. Its action is to adduct, A-D-D, add together, adduct, flex, and medially rotate the thigh. The adductor longus is shown here. And the adductor longus has its origin on the pubis near the symphysis. It inserts on the linea aspera, and its action is to also adduct, flex, and medially rotate the thigh. Notice that that is the same action as the pectineus. Our next adductor muscle has two origins, and it's called the adductor magnus. And it has, because of these two origins, it actually looks like it's two separate muscles. But they are both the adductor magnus. The origin, one origin is the pubis. Another origin is the ischium. It inserts on the linea aspera, and it also adducts, flexes, and medially rotates the thigh. Now, here are three muscles. Two combine to make the third. Shown here is the iliac bone, the ilium, and the iliac crest. And you can see this muscle in the iliac fossa, and that is called the iliacus. There is also this muscle that's going along the lumbar vertebrae, and that's called the psoas major. You can also see the psoas major over here, along with the iliacus next to it in the iliac fossa. They both combine and then exit. This white structure that you're seeing here that I'll highlight is the inguinal ligament. And the psoas major and iliacus come out of the abdominal cavity and surface on your anterior thigh. When they surface on the anterior thigh, they are lateral to that femoral vein, artery, and nerve. And when the iliacus and psoas major emerge on your anterior thigh, we now call it a different name, iliopsoas. So again, it says in your hit list you should know all three. And they are going to work together to flex the thigh and trunk. What's an antagonistic muscle group that you have already learned? The erector spinae muscle group that extends your thigh or extends your hip. Here's another picture of the abdominal cavity, and again you can see the iliacus, the psoas major, and then they both emerge on your anterior thigh that I'm highlighting here in this magenta color, more lateral to the femoral vein, artery, and nerve. So their origin is the lumbar vertebrae, that's for the psoas major, and the iliac fossa, that's for the iliacus. They will insert as the iliopsoas on the lesser trochanter. And again, it's going to flex the thigh and the trunk. Moving to the posterior side of our thigh, our first muscle up here is the biceps femoris. Biceps. That tells us there are two origins. And it's this muscle here. This big muscle is on the lateral side of your posterior thigh. Here it is shown on this model. It's on the lateral side of your posterior thigh. Its origin is the ischial tuberosity and the linea aspera. It inserts on the fibula and tibia. Its action is to extend the thigh and flexes the lower leg at the knee. So this is part of your hamstring muscle groups. And the hamstrings are going to help with extending the thigh, but flex the lower leg. That's going to be an antagonistic action to the quadriceps femoris group, which extended the lower leg. So again, antagonistic muscle group. Now the next two muscles of the hamstring muscle group are the semimembranosus and tendinosus. And I always remember semitendinosus as having a T in the name and it being on top. The membranosus is deep to the tendinosus. You can see just a little part of the membranosus sticking out here and here. This muscle that I'm highlighting in green is the semitendinosus, and I will again show you this on the next slide. So the membranosus is underneath the tendinosus. The membranosus has its origin on the ischial tuberosity and it inserts on the medial condyle of the tibia. Its action, like the biceps femoris, is to extend the thigh and flex the lower leg. The semitendinosus, let me highlight that again for you. Is that muscle there? Here it is on this side. The semitendinosus has its origin on the ischial tuberosity as well, and it inserts on the medial aspect of the proximal tibia. It is going to extend the thigh and flex the lower leg at the knee. Now we have the tensor fasciae latae. Sounds like it's a Starbucks coffee. It's this tiny little muscle here on the lateral aspect of your thigh. And this white part that you see down here is the fascia that it's going to insert into. It's called the iliotibial tract of fascia. So the origin of the tensor fasciae latae is the iliac crest and anterior superior iliac spine. It inserts on the tibia by going through this iliotibial tract, this fascia. Some people just call it your IT band for iliotibial tract. Its action is to steady your trunk on the thigh. Our next muscle is the gluteus maximus, shown here on this model. But it's also shown here on this larger model and on here. The gluteus maximus has its origin on the ilium, sacrum, and the coccyx. It inserts on the gluteal tuberosity. Its action is to extend the thigh. The next muscle is the gluteus medius, shown here on the large model. I'm highlighting it in blue. You can see that its fibers and fascicles go in a different direction than the gluteus maximus. The gluteus medius on this model, to the left of on your screen, is shown right here. It's marked as 1A. So that's the gluteus medius, which has its origin on the ilium. It inserts on the greater trochanter, and it abducts and medially rotates the thigh. Now we move on to our 5 lower leg muscles. This muscle shown here is the gastrocnemius. It's part of the triceps surae. So there are 3 muscles that are found here. The gastrocnemius has 2 heads to it, so that's why they call it the triceps surae, or part of that muscle group. The gastrocnemius has an origin on the medial and lateral condyles of the femur. It inserts on the calcaneus through the calcaneal tendon, oftentimes called the Achilles tendon. Because it crosses 2 joints, the knee, and then also works at the ankle joint, it has 2 actions at those places. So it's going to flex your lower leg, but it will also plantar flex your foot. So again, that's the gastrocnemius. You can see its 2 heads here. And then it inserts onto the calcaneus through the calcaneal tendon, also known as the Achilles tendon. The other muscle of the triceps surae muscle group is the soleus, and the soleus is deep to the gastrocnemius, just underneath of it. It's going to originate on the head of the fibula and also on the tibia. It inserts on the calcaneus through the calcaneal tendon. It will only have an action across the ankle. It is going to plantar flex the foot. The next muscle is the fibularis, also called the peroneus longus. Its origin is the head of the fibula. It's going to insert on your first metatarsal and medial cuneiform. Its action is to plantar flex and evert the foot. So let me highlight that muscle. It's going to plantar flex and evert the foot. On the anterior side of your lower leg, we have the tibialis anterior, shown here. The tibialis anterior is going to originate on the lateral condyle and tibial shaft. It's going to insert on the medial cuneiform and first metatarsal. Now that was the same insertion as the fibularis, first metatarsal and medial cuneiform. The tibialis is going to have an opposing action to the fibularis longus, or fibularis peroneus longus. Its action is to dorsiflex and invert the foot. Yet these two have the same insertion. How is that possible? The tibialis anterior gets to the first metatarsal and medial cuneiform from a superior approach. However, the fibularis peroneus longus actually goes around the fibula and then goes underneath your foot to get to the first metatarsal and medial cuneiform. So it goes under. It's taking a inferior approach to those insertions. So that is why the fibularis is antagonistic to the tibialis anterior. The extensor digitorum longus is this muscle here, and you can see its tendons splaying out. The extensor digitorum longus originates in the lateral condyle of the tibia. It's going to insert on the middle and distal phalanges of your toes, digits 2 through 5. Its action is to dorsiflex the foot and extend your toes. That concludes our demonstration for the muscles of the thigh and the lower leg.